Wonderful. Thank you. Good afternoon, everybody, and happy lunch hour, right? This is a lunch and learn. So thank you for spending your time with us. We know that your time is valuable, and we appreciate that you chose, again, to spend some of that time with us. And our goal is to help teach you as a family caregiver how to better support yourselves, or if you work with family caregivers, how to better support them. For those of you who I haven't yet had the pleasure of meeting, my name is Bryn Seaman, and I'm the Caregiver Programs Specialist with the Greater Wisconsin Agency on Aging Resources. We're better known in the States as GWAR, GWAAR. And I provide training and technical assistance to the caregiver coordinators and specialists across the state. And the goal is to strengthen our caregiver programs. I'm also honored to be a co-leader for our Wisconsin Family and Caregiver Support Alliance. It's a grassroots coalition of family caregivers, professionals, advocates, and educators working together to strengthen support for Wisconsin families. I also have about 20 plus years in aging and disability services within leadership roles and case management and management, you name it. So all of that experience blends in really well with my priority in this current role of focusing on improving how we support family caregivers through policy, through partnerships like the one with Trualta, and then practical tools also like Trualta. I'm only going to take a couple minutes of time. I asked Sue ahead of time if it was okay if I just share a brief history about our relationship with Trualta, and then I will turn it over to Sue. She does an amazing walkthrough. I want to say this is the third or fourth Trualta event we've hosted. We've had wonderful participation and feedback from our Alliance members and others. Just really appreciative of the overview and the free services and resources available through Trualta. So a quick update about our history for those who might be unaware. Our state partnered with Trualta several years ago, and we were able to contract for services using COVID relief dollars. Then when that initial contract ended, we were fortunate through the leadership of Lynn Gall with the State Bureau of Aging and Disability Resources. It's called BADER. We like our acronyms here. And they were able to pursue, she's also, by the way, a very active member of our Caregiver Alliance. And I think that's important to note because we have several different agencies, nonprofits, counties, DHS, family caregivers, nonprofit organizations, and others coming together to work within the Alliance. But with Lynn's leadership, we were able to apply for and awarded a 2-year Administration for Community Living grant. And it's that grant that's helped us fund Trualta for Wisconsin across the entire state through 2025 and through 2026, again, making it free to everybody in Wisconsin. And we continue to explore further grant funding in hopes of keeping Trualta available free for every Wisconsinite for many years to come. And that's also part of our message today. We want to expand our outreach, our awareness, so that Wisconsinites can reap the benefit, first of all, but then secondly, speak to those benefits, sharing firsthand the value that they have experienced from Trualta. And that can be with other family caregivers, but even more specifically toward our policy and advocacy focus, sharing that experience with policymakers. So if you follow us on Facebook at all, you've seen our call to action alerts asking that you reach out to your local legislators to share a very quick snippet, a caregiver story or an experience about your work with Trualta or the benefit that Trualta has played in your life. Or if you're already signed up for Trualta, a big thank you. We appreciate that. But also you may have, on occasion, experienced a quick short survey that's popped up, and you've been given the opportunity with that survey to share your experience about Trualta and also give feedback if you're interested with your local official, our state legislators. The reason that we're taking these steps is to build enough awareness to demonstrate the positive impact of caregiver training and education so that it becomes permanent funding. caregiver training and education should be an easy policy decision and, frankly, a budget priority for our state in many years to come. Family caregivers, I'll go into the statistics really quick. Caregiver training and education matters. There are over 1 million family caregivers in Wisconsin alone, over 60 million in the nation. That's not counting youth caregivers or folks under 18 or people who maybe don't identify yet as a caregiver. And about 8% of those 1 million family caregivers, only 8%, report receiving any type of formal training for their caregiving role. That's a very low percent. I mean, that's imagining like if you're stepping on your job for day one and 8% of the workforce was actually given some type of formal training. That's not a benefit, right? That's a deficit. So what this means right now, currently in our state, is we have spouses caring for a loved one with dementia who may not know behavioral strategies to manage day to day. That might mean we have an adult child in their 30s, 40s, 50s helping a parent after a stroke or another type of accident or health event and not knowing how to safely assist them. Maybe they're doing hands-on personal care or physical tasks like helping to go to the bathroom or grooming or bathing or transferring in and out of a wheelchair, in and out of bed, in and out of a bathtub. How to do that safely for both the person assisting so they don't hurt themselves, but also for the person who's needing the help so they too aren't getting injured in that process. Without training, what this also means is that parents are caring for children with complex medical cares or for children with intellectual disabilities without any formal training and maybe not the right connection to resources. So they're left to figure it out on their own, which is often what parents have described their journey to be, which means that they're missing access to paid care, to other resources. So Trualta addresses each of these caregiver situations and so many more different caregiver situations with their 24/7 access to practical, easy to use, short videos, printable materials, and step-by-step guidance for real caregiving situations. Trualta also offers peer support through virtual support groups, blogs, book clubs, and access to professional evidence-based education. I know Sue will be sharing quotes and caregiver experiences about how Trualta has helped many of the caregivers who utilize the platform. And I hope those resonate with you. So when she pulls those quotes or share those stories, put yourself in those positions. So if you aren't currently a caregiver now, you could very easily see the benefits and why folks are sharing what they are sharing. In closing, and I promise this will only be about another 30 seconds and then I'll hand it over to Sue, I'd just like to share the real impact of what we're seeing. In 2025 alone, so now I know this is about 6 months old, but in that 1 year calendar year, we've experienced an estimated $5 million in cost savings for Wisconsinites. That's been driven by the 15-month delay of a nursing home placement for a loved one or a person they're caring for, and or a 20% reduction in unplanned hospitalization. That's directly related to the training and support from Trualta. This has allowed caregivers to be more confident, more supported, and able to sustain care longer in their home through the education and training that Trualta provides. So we encourage you to explore Trualta for free. Whether you're a caregiver, you know a caregiver, or you work with caregivers, this is also a great resource for professional staff too. Caregiver support group materials, an easy way to access ready information and to print off to the caregivers you work with. We've also noticed that many employers are even incorporating Trualta into their employee benefits package or their dashboard on their employee benefits resource page simply because of its value. So with all of that, I am pleased to now turn it over to our partner, Sue Morawski with Trualta, who will walk through the platform and share more about the resources and opportunities available. So enjoy, feel free to ask questions, and please, I'll monitor the chat. So you're welcome to put questions and feedback in there as well. Thank you.
Well, thank you, Bryn, and I am just really excited to be here today. My name is Sue Morawski, and I am a client success manager here at Trualta, who works very closely with all the state staff members who provide caregiver services out in the community where you live, where your other family members might live. So it is available all throughout the state for any caregiver. And with our partnership, this is free to you as a caregiver. If you're a caregiver joining us for the first time, welcome. We're here to learn and explore a little bit more about Trualta together. If you're already connected to Trualta, please share your experience in the chat so others can learn from what you've learned with Trualta. I too am a caregiver. I live in Phoenix, Arizona. I've been with Trualta for about 4 years, so a little after the original program started with Wisconsin. And I travel back to Wisconsin quite frequently to visit family. So I'd like to be able to share with you just a little bit about Trualta. So if you're familiar with Trualta or you're already connected to our platform, please just type in yes in the chat. And for those of you who are not familiar with Trualta or are here to learn a bit more, you're really in the right place. So Trualta is a interactive learning platform that was designed for the informal caregiver to provide care to individuals at home. Jonathan Davis founded Trualta in 2018 as the first remote evidence-based caregiving training and support platform. And we have really grown since. We provide clinically validated education for family caregivers to provide better care at home, keeping their loved ones at home longer and safe, and providing support for caregivers themselves. So why do we do this? We know that most family caregivers provide unpaid care for aging loved ones, family, friends, neighbors, as well as individuals with complex medical needs or special needs children, often without that training and support. And so Trualta supports the ever-growing number of caregivers with our platform, training, and support to help keep loved ones at home longer. It's important for us to help make a difference. Trualta has over 90 partners, and it's growing by leaps and bounds. And Trualta has currently is in 35 states. And with our partnership with GWAR, the state of Wisconsin, we're able to support caregivers at no additional cost to any person living in the state of Wisconsin or caring for someone in the state of Wisconsin. So as Bryn mentioned, the statistics, I'll just go over them briefly. So today, where we're at and what's happening in Wisconsin. So caregivers need more support more than ever. 1 in 4 adults are caregivers. And I'm actually one of those statistics, as I'm sure many of you are as well. And according to Caregiving in the US report provided by AARP, there are 63 million Americans who represent that 1 in 4. That's just amazing, isn't it, when we think about that statistic? And this is a 50% increase since 2015, and it continues to grow. So in Wisconsin, as Bryn mentioned, only 8% have received training to help with ADLs, which is activities of daily living, and behavior management. 55% of caregivers are still working while caregiving, and that's me as a statistic. National statistics, only 22% of caregivers have received training. So just kind of a comparison between Wisconsin and the national, we can see that in Wisconsin, it's much lower than the average throughout. Had I known about Trualta when caring for my dad, this really would have been a game changer for me as a caregiver. And as I continue helping my mom, helping my uncle, This information on Trualta, I'm in here all the time looking at different articles and resources to be able to help me help them. Caregiving is growing in the workforce as well, and it can be challenging. So for many employees, it becomes a second job that they really never signed up for. Employers who support caregiving see higher retention, lower absenteeism, and stronger engagement. When we look at Wisconsin, 38% are in that sandwich generation of caregivers, supporting both children or grandchildren and adults. So when we look at the average US wide, that's 29%. So again, in Wisconsin, that's a little bit higher than the average. They're supporting parents and children all at the same time. 60% of caregivers monitor the health of their care recipient. So that's like one of my caregiving duties for my uncle, really helping him navigate through the healthcare system, going to doctor's appointments, things of that nature. 64% communicate with healthcare professionals, and 56% advocate on behalf of their healthcare recipient. So older adults are projected to outnumber children under the age of 18 for the first time in history by 2034. And that's according to the Census Bureau projections. And so now you can see why we feel so honored to be able to help support caregivers. And that's why we need to support caregivers more than ever. So if you are already connected to Trualta, share out this information with other people you may be in contact with. If you're not connected to Trualta, we're going to talk about a little bit more about what Trualta is about and then give you an opportunity to be able to register. So at Trualta, we believe in meeting caregivers where they're at. We provide professional level training and adapt the messaging, simplifying language and removing any confusing healthcare jargon. We customize the learning for every caregiver based on their needs and the information that's provided with a few questions during the onboarding process. The platform itself is available 24/7 and can be accessed on any device. So you can use your laptop, your tablet, computer, or even your cell phone. And we offer bite-sized segments. So on average, the learning modules are between 2 to 8 minutes. We know caregivers are busy, so we want to be able to provide information very quickly to caregivers. In our learning library, we have what we call toolkits. And within the toolkits, we provide articles, videos, scenarios, and resources to help caregivers every day. We also offer a community for caregivers, and this is through our live events. So Bryn talked about this briefly in her introduction, but we have live events to be able to help support caregivers. These are virtual events, and we have support groups, webinars, we have classes, book clubs, and we meet you where you're at. So we have customizable ones where they're specific in regards to dementia or caring for a parent, for an example. And then we also have what we call a forum or a chat room where caregivers can connect to caregivers across the country at any time. So what I'd like to do now is share a story of a caregiver. And caregiver stories and testimonials are so important to be able to share and really show the impact. So let's take a look at a story here. Behind every caregiver toll lies a caregiver story. So I'm going to play this now. And if you can't, Bryn, let me know if the volume works okay.
When I first started caregiving, it was the hardest thing I ever did in my life.
It's good.
All of a sudden, I got this email from Trualta, and I clicked on that link, and it's changed my life. It helped me emote, in the groups in the beginning, struggling with my mom, struggling with me, struggling with the family that disowned me. I got to meet some people that are incredible caregivers. I got to meet outstanding support mentors, you name it. And it's just so caring and has helped me become as strong as I am today. Because I felt like very weak in the beginning and alone, and I'm not alone anymore. And there's people that understand what I'm going through. Because my friends, and I've got some really close friends, they don't get it because they've never had to do this before. So Trualta is very, very important. I feel like it is beyond great therapy. I mean, I look forward to this all the time. So thank you.
I can never get enough of these stories that
When I
are
first
here.
started
So,
caregiving, it's the hardest thing I ever did in my life.
but if you noticed, she felt very overwhelmed. And even though she has friends that she can rely on, those friends didn't kind of really realize everything that she was going to. So that's where Trualta comes in, and support groups locally come in as far as being able to be in a community of caregivers. And so that's really important, to be able to have people who are kind of going through the same thing that you're going through, to be able to share your experiences together. So I really encourage to be able to check out the live events that Trualta has, because it truly is a community of caregivers. So as we dive into more of the components within Trualta, here's a list of key competencies and conditions for caregivers to be able to access. So if we look at the conditions, we've got things like dementia and Alzheimer's. We've got heart health, diabetes, lung health, kidney. We also focus on foster care, grandparents supporting grandkids, for an example. And some of our newest toolkits are cancer care, and being able to balance work and caregiving, having those conversations with employers. And as Bryn mentioned, many Wisconsin employers are now jumping on to be able to help support their employees through the process of caregiving. So that is amazing as far as the leadership in Wisconsin, and really kind of taking the lead on this. We've also got a brand new toolkit that was released last quarter, and that is substance abuse. So a lot of things happen within substance abuse that are hard to understand, and Trualta really kind of takes bits and pieces and helps break it down so it's easy to be able to manage. Some of the key competencies that we focus on are things like responding to behaviors, safety and injury, making your home more safe as your loved one comes home, maybe from the hospital, and removing barriers that may be trip hazards, for an example. Looking at managing symptoms. First, you have to be able to identify those symptoms, and then tips to be able to manage the symptoms that are occurring. Personal care, as Bryn mentioned earlier in the intro, things like bathing or safe lifts and transfers. It reminds me of a story of when I had to assist my dad with lifting and going to the restroom. He would always tell me, Susie, I just love how you walk me through and talk me through the process. So it's tips like that that really help and make not only you as the caregiver safe, but also the care recipient safe. Planning for the future. We talk about things that are in the beginning of the caregiving journey and what to prepare for longevity of the caregiving journey. Navigating healthcare visits. As I said, this is an important piece. We only have maybe 5 or 10 minutes in an office of a doctor, for an example. And so Trualta helps prepare you for those healthcare visits. Supporting wellness, not only supporting the wellness of the care recipient, but also the caregiver. We can't pour from an empty cup. And so with Trualta, we really help support caregivers. And so one of our live events that we do offer is Relax and Recharge, taking a moment to yourself to breathe, to remember things that are helpful to you and taking time for yourself. And as we talked about a little bit in the intro as well, these are bite-sized pieces. We offer it in different modalities for learning, such as audio, video. We print off materials. The platform itself is available in English and Spanish with a quick toggle. And all of the information on Trualta is provided by professional level experts such as doctors, nurses, and therapists. And then we take that information, take out the healthcare jargon that might be confusing, and we rewrite it into a 5th grade reading level. And then we are ADA compliant as well. And as Bryn said, it's all evidence-based training that we do offer on Trualta. So with the community of caregivers and our live events, this is where caregivers can connect and sign up for special sessions in groups of small groups, or they can also do things like drop-in groups where they can't really commit to a 4-week session, but they can commit to a one day maybe. And so there's no commitment. It offers flexibility for caregivers. We also have anonymous support groups where cameras and microphones are off. So if you really want to be anonymous, you can just type in the chat and just listen in to what the care educator has to say. They'll read off all of the information that is put in the chat for conversation to go back and forth within the chat. And then we have novelty options as well, such as classes, book clubs. We have a podcast style called Care and Share Show. And with our forum, we also have an anonymous, so you would have your first name and a code behind it, a numeric code behind it, or you can choose to change your name and have your name listed on forum posts as well. So this is where caregivers can read stories of other caregivers, post their own stories, and share and react to stories that are written on the platform. And as you can see, I just have a couple of quotes that caregivers have actually written. Thanks for giving me time to find peace and calm. I feel less alone and filled with new ideas. So these are great testimonials that caregivers provide based on what they're reading, what they're participating in on Trualta. So now let's take a look at outcomes. So this is where we can get your feedback on Trualta. So we have 25% that are what we call power users. These are caregivers looking at 15 or more activities. 82% of users report that Trualta has helped them learn a new skill. 92% report Trualta has built their confidence. 89% reported Trualta has improved their sense of belonging. And 90% reported Trualta has improved their ability to manage stress. So what does that mean? Those patient outcomes with a study that we did with Trualta, as Bryn mentioned early in the intro, with the patient outcomes, the estimated annual cost savings for families is at 6.4 million. Now, this slide, I'm sure I could update this slide and it's going to be a little bit higher than that. But when we created this deck, that's what the cost savings were. So it's a little bit older, and I know that those cost savings are higher than what you see on the screen today. So I do want to share with you that currently with Trualta, this project is supported by the Administration for Community Living, or ACL, U.S. Department of Health and Human Services, as part of financial assistance, award totaling $490,000, with 75% funded by ACL, HHS, and $163,000 and 25% funded by non-government sources. And so the contents of those authors and do not necessarily represent the official views of, nor an endorsement by ACL, HHS, or the US government. But what I will say is it is important, if you are not connected to Trualta and you are a caregiver, or if you know a caregiver, direct them to wisconsincaregiver.trualta.com and register. So you can do that very quickly. Registration itself just takes a few minutes to be able to register to the platform. And we've got flyers and information if you're interested in receiving them. If you're an organization, please feel free to reach out to Bryn or myself, and I am sue@Trualta.com, and we'll get you some handouts that you can provide to your community. But if you're a caregiver, please feel free to link. The link is in the chat. I just saw Bryn put it in the chat. So please feel free to click on that and begin your registration. So are you excited to see this live? I can show you a demo live, but I'm going to pause for just a moment just to be able to see if there's any questions in the chat right now while I pull up the website itself to be able to navigate through. And don't be shy. Feel free to take yourself off mute too.
I took myself off of mute. Hi, my name is Trisha Vertigan. I'm an elder benefits specialist as well as a family caregiver support coordinator for Marinette County Elderly Services. I also was and continue to be a caregiver for my mother. So I'm part of that sandwich generation. I signed up for Trualta and I've gone in there. One of the things that I was trying to figure out, and maybe the two of you could help me with this, is there's so many different topics, right? When you go in to pick. And when I'm looking for myself, right, if I'm just going for myself, I like having all of those topics. Is there a way to kind of toggle between my work, what I need, the resources, versus what I am doing just individually on my own?
There is a caregiver view that you can look at, and there is a staff member view that you can look at. But if you type in your email address, Trisha, I'm happy to kind of walk through that after this presentation today to be able to kind of share a little bit more with you. Does that work for you? But there is a little shortcut that you can do.
All right. Thank you. That would be great.
You're welcome. Thanks for sharing too.
Of course. Always share.
Okay, so we're going to go to the platform live just to be able to look at features. And Trisha, as you said, there's a lot of information on Trualta. And So your onboarding questions will help be able to provide a customized homepage for you. So once you register to Trualta and you click all of the different features that you would like to be able to get information on, or look at articles or videos, things of that nature, this will all be customized for you based on your onboarding questions. You can always go back in and change information when you go up to your little name here at the top, and you can add additional topics to your profile as well. So, but there is over 120 hours of learning on Trualta platform. So it can be, if you don't know where to start or you want to look at something, we've got some caregiver picks for you. We've got what's popular, posts from other people caring for individuals, and then recommendations down here at the bottom. So we also have expert caregiver guidance that's going to provide you with some quick little resources for you to explore. And then down here at the bottom, I have what we call 3 buckets. Our learning library, which has over 120 hours of learning. We've got our events, which we typically do between 70 and 80 different events each month. And then our forum, where you can go and chat with other caregivers. And then you'll find those all at the top as well. So we've got our learning library, our events, and our forum. And then we also have a button called support. And this is where you can find additional resources that are local to Wisconsin. So we've got caregiver resources, local events that are happening, and then a link to be able to look at Facebook as well. So in our learning library, if there is a diagnosis or a burning question that you have, please put it in the chat. But otherwise, I'm going to show you a couple examples just by typing in some keywords. So as you can see, if I just kind of click on that box, it's going to give me some popular searches. But I'm going to type in dementia, which is one of the most prevalent diagnoses that we see at Trualta. So if I type in dementia and just click on the box after dementia, here is where I'm going to show 238 results for dementia. And as I mentioned earlier, we have what we call toolkits. I can bookmark those toolkits to make it ready, accessible, and it's going to be in my learning then. If I click on the toolkit, that's where we're going to find the articles, the videos, the scenarios that are available. We have what I like to call chapters in a book, being able to tell you what's in each section. So if I look at dementia basics, for an example, I can look at an introduction to dementia, dementia facts and myths, and it's going to tell me the exact time that it's going to take me to either read it or I can play it in audio. And by playing in audio, this is a great way to be able to multitask. So if you're folding laundry, for an example, or preparing a meal, you can actually listen to the articles on Trualta as well. So again, it's going to be bullets, very easy to be able to follow along and read, or I can play this, which I'll play just for a few seconds.
Introduction to dementia. What is dementia? Dementia is a general term to describe a set of symptoms that affect brain function.
So it kind of reads the article, and you're able to do other things while you are listening to some good information. Over here on the right-hand side, it'll tell you your progress within that toolkit, and you can go to the toolkit navigator to skip to something else. Teepa Snow is well renowned in the dementia world. And so early on with Trualta, she partnered, and we have several videos that feature Teepa Snow. And so with our videos, we have closed caption that you can also be able to look at. And you also have transcripts that are available. And again, with an easy toggle, this is going to go from English to Spanish. So up at the top is where you'll find that toggle for English and Spanish. So if we kind of take a look at Tipa Snow here, we can play this. And I'll skip over just a little bit. And Tipa's talking about
people
the difference
think
between
they're like the same word, and what they really mean is
Yes.
people have memory problems, but that's inaccurate. So dementia is a great big umbrella term. And under that umbrella, and what that umbrella means is you have at least two parts of your brain that are dying, unfortunately, and it's going to progress. And there is nothing we can do to cure it or stop it right now. And ultimately, it's a condition that will get so bad that it will result in your death if you have this. So that's what it means when you're under the umbrella.
So Tipa kind of goes into it and simplifies the information in regards to family history and finding good care facilities. So many videos that Tipa does on the platform. Again, she's wonderful. She's uses her hands a lot to kind of talk, really simplifies things and makes it easy for you to be able to understand. You can mark things as complete, so you can check your journey as you go through. And then you can also make the information available so that other people know what you thought of this. So whether you love it, whether you find it comforting, whether you find it practical. So what did you think of that? So encouraging. You can also make a comment in regards to this particular comment. And I encourage you to make comments so that other caregivers, as you can see, it was helpful and been useful to me. The comments that are here. And as you can see, it's name and an assigned number, or you can edit your display name and you can type in, let's say, anonymous, for an example, or you can type in turtle, for an example. You can have whatever your display name as you see fit. So if you want to be completely anonymous, just type in anonymous, and that's the way it'll be written. When we look at our learning library, and we can look at things like cancer, for an example, and we can see all of the things that are relative to cancer. We've got our forum discussions here. We've got a 8-minute video here, an article, for an example, that understanding the cancer lingo. So here's a glossary of terms and what it means. So again, simplifying it. And then here's some event recommendations that you could join in regards to this particular topic. In our events, again, these are ones that caregivers can join in. We've got for you. This is again based maybe on your onboarding questions. We've got all events, and I'm just going to scroll through. So it might make you a little bit dizzy here because there's a lot of them. I'll scroll through so you can see the number of events that Trualta does offer. And because we are closer to the end of the month, you will see more that are filled up. So just look for one that says open to join. Or if you do see one that event is full, you can always join the wait list. So if I click on an event, for an example, and this is caring for a child, for an example, I can see a sneak peek inside. So the care educator who is providing this particular anonymous support group, it tells you anonymous, so cameras are off, cameras and mics are off, for an example. She's going to give you a sneak peek and what to expect. You can register by clicking on the registration, and you're going to confirm the registration. And then you can meet the host down here. And here's what other caregivers have said about support groups. So a lot of information for you to be able to kind of explore and look at. And remember I said caregivers, we care about you as caregivers as well. So this is where you can look at events and you can filter out specifically whether you want a support group, webinar, graduate support group, anonymous, classes, the day of the week that works best for you. And then if you're attached to a particular host, you can also look up information by a host. So I'm going to click on Jaquel because Jaquel offers a wonderful one for caregivers to be able to relax and recharge. So I encourage you, as one of the sessions that you would sign up for, to sign up for this particular webinar. Cameras are off, but it's a great way to just be able to have some guided relaxation with Jaquel. And I'll tell you, her voice is so soothing. I love taking this particular webinar. So I encourage you to do that. Within our forum, this is again a place for caregivers to be able to chat with other caregivers. And you'll see names like Monique at Trualta. This is one of our care educators as well. So you can look at the different groups and you can look at your activity and follow your activity. I don't personally have one here in the Wisconsin site, but you can look at the activity. You can also share your own story. And again, your display name will be written here, but if you want to be anonymous, you can just change your name to an anonymous and then save the changes. So this is caregivers across the country that use our forum as well as our event. Are there any topics now that we've kind of gone through a couple different topics? I'm going to type in bathing for an example. And you can see different topics on bathing, but I'll just hit enter afterwards. And you can see things like showering and bathing post-stroke, for an example, or addressing bathing challenges. That's a common one for caregivers. Resistance to showering, and helping you with activities and taking a look at general care tasks within the bathroom in general. So toileting, tooth care and mouth care, and then bathroom safety. What do we have for bathroom safety? So again, here's a video, bathroom transfers, how to do bathroom transfers safe, how to make the bathroom more safe. So fall prevention in that sense are some of the things that you can take a look at. Are there any other topics that we want to explore today? Again, take yourself off of mute or feel free to put in the chat and we can explore. We have about 8 minutes, and during that time, if there are any questions, feel free to take yourself off of mute or add your question within the chat as well. And so I'll pause for a moment because I'm going to take a sip of water and let anyone come off of mute to be able to ask a question.
So this is Bryn. I don't necessarily have a question about a topic, but one of the features you mentioned and that I've actually used is the ability to print off an article. Now, I come from it on a lens of a professional capacity where I share with caregiver coordinators and caregiver specialists throughout the state that, you can use these topics in your caregiver support groups. You can even play a short video to help it be an icebreaker and get conversation going. And you can even print off, materials so that you have walking away guidance to give to your caregivers. But this happens in families all the time where you're sharing responsibilities, maybe with siblings, or a neighbor is helping you out. They're going in to check on your mom and you're taking the lunch hour when you leave from work, and they're checking on her in the evening or the morning. And so there's typically some partnerships in caregiving is my point. And if you find something that's valuable or helpful and want to share that, in addition to encouraging them to register for Trualta, you can also print off some of the materials and be able to share it. Is there any like a quick one that comes to mind that you're able to give us an example of?
Absolutely. So 3 ways to encourage showering, for an example. If you find that this is a good read, I'm going to talk about 2 different ways that you can be able to share this information. So, as you mentioned, being able to print off the article and keep it for yourself or share with someone else. You just print off, you just click the print button here in the article. Or if, let's say, you're a caregiver in Wisconsin and you have a family member in Arizona, and you want to be able to share this information over, many of our articles will have this share button here at the top. And so I'm not connected to Wisconsin as a family member, but I'm coming to visit and help my sibling in Wisconsin take care of my mom, for an example. I could, as a Wisconsinite, I could hit this share button and I can copy this link and I could share it with another person in another state. Now, it would not take them to the Wisconsin site, but it would take them to our general Trualta site to be able to view this particular article. There are parameters around this share button, and so caregivers can share up to 5 times. And if they share this information, then the other family member or friend who's in another state can easily look up their zip code and see if they're connected to an agency within the state that they particularly live in. So this is a great feature for sharing out with other caregivers who are not in the state of Wisconsin. So you can print it off or you can share it out. And again, there are share parameters around this. So you can only share out 5 times and then it won't allow you to share anymore. So make sure it's an important one that you want to share with someone else. So great feedback, suggestions, and reminders that we can share out this information and print off as well. I am not seeing any questions in the chat. Are you seeing anything, Bren?
No, I don't either. And actually, I learned something new. I feel like every time we do a wonderful Lunch and Learn presentation, I'm always caught off guard by how emotional I get from the caregiver stories and what impact that has. But also, I learned something new every time. And I knew we could print it and we could share the material. It hadn't quite stuck with me if I've seen it before. Or maybe this is the first time I'm really zoning in. I didn't realize you could share it electronically like that and copy and paste the link. So I think that's wonderful to be able to encourage other states, if they don't have it, to consider this as a valuable resource. As you shared earlier, there's 35 states that already utilize Trualta. It would be amazing if it were almost, nationwide, because then it's easy to transfer information and to get people to the places they need to be.
Absolutely.
I was going to ask one more quick question before we go. Are we able to share this training that we just had with our support groups?
Yes, absolutely.
Okay.
So walk them through it. Or Trisha, if you have sessions that you're going to do, feel free to reach out to me, and I'm happy to do this one-on-one with your groups.
Oh, wonderful. Thank you. Yeah, that would be great.
Awesome. Well, thank you all for joining today. I'm going to just go back to our PowerPoint just in case there is anyone who would like to register who is not already connected to Trualta. So go to wisconsincaregiver.trualta.com, or you can even use your phone and you can scan that QR code and it'll get you there as well. But thank you so much for sharing your time today. Please be an advocate. Share this out with all caregivers that you know of. And it's really identifying as a caregiver, right? So I didn't really identify as a caregiver. And so some of the tips that you see on the left side of the screen, do you perform housework for someone? Do you help them shop for food? Do you help them bathe or get dressed? Do you drive them to appointments? Do you help, get up with them at nighttime to make sure that they're safe? Or do you pick up medications? Those are all caregiving duties. And so this is a great way to be able to connect caregivers. So thank you again for your time. I appreciate it, and have a wonderful rest of your week.
Thank you. Goodbye.